ethical values should be there, morality should be there. When we are talking of our practices, we are talking research, or even we are a teacher, we should be morally sound to put anything to the population or the masses. Definitely, it is our basic human entity to be filled by all this goodness. Thank you very much, ma'am, to spare time from your busy schedule.
Thank you. It's an honor. It's an honor.
Thank you very much. Now, ladies and gentlemen, we have another speaker here, Professor Muhammad Alamuddin Qamri, sir. And within no time, sir, I will let you be able to share your slides.
Please ask them to enable the sharing content, please.
Okay, sir. Making
please.
Ladies and gentlemen, we are in no time. Inshallah, he will make a presenter. Let me introduce Dr. Muhammad Alamuddin Qamri, who is presently working as a professor and head department of Tanzania, and also the HOD of Maulijat, National Institute of Unani Medicine, Bengaluru. Dr. Alamuddin Qamri, he has been my teacher there when I was doing my master's from Bangalore. Thank you very much for joining us, sir. He has 21 years of teaching and 16 years of research experience. He has guided 27 PG scholars at NIM, and 2 PhD students have completed and submitted their thesis and awarded, and 3 are under their guidance. His area of research work is musculoskeletal diseases, Ilaj Tadbir, psychiatry, life-style diseases, and dermatology. He has more than 100 scientific and research articles to his credit, including his original research papers published in peer-reviewed international journals. He has attended 20 ROTPs and semi-workshop webinars and more than 25 national workshops as a speaker and 25 as in the international workshops as a speaker. He has given some additional responsibility as he is a very good manageable person. He is a good administration. He is the coordinator of Intermediary Pharmacovigilance Center for Unani Drugs, Ministry of Ayush, Government of India, New Delhi. He is the academic in charge at National Institute of Unani Medicine, Bangalore, and member secretary, Institutional Ethics Committee for Biomedical Research at NIM. He is member of Board of Studies for Postgraduate Unani at Rajiv Gandhi University of Health Sciences, Karnataka, Bengaluru. And he is a member of editorial board of General Research in Unani Medicine from National Institute of Unani Medicine. Ladies and gentlemen, he will be speaking on the topic significance of Tadbir, Istifrag, Hijama, Irsal Alaq, and Fasad in the management of arthritis.
Thank you very much, my dear Dr. Abdul Aziz, for the very concise and very beautifully spoken out introductory words about me. I'm very much grateful to you. And before going to present my, is it visible?
Yes, sir. Yes, sir.
Screen is there now? Okay.
Your screen is visible, sir.
Yeah.
Slides are visible, sir.
Yeah, thank you. Before I start the presentation, I'm very much thankful to the organizers. Particularly, I have a very heartfelt greetings to this organizer, Professor Muhammad Anwar sir, who is my mentor also. I worked with him. The platform is playing a very important role as the convener of extramural research, extramural lecture series under the Faculty of Unani Medicine. In a very big panel, Hakim Ajmal Khan Memorial Extramural Lecturer, Ajmal Khan Tibiya College at Muslim University. I'm very much happy to have this presenting myself in this series of lectures. Very respectable, my senior and the Dean of Unani Medicine, Ajmal Khan Tibiya College, Professor M. Shirani sir, Professor Saudali Khan, the principal, my mentor and the convener, Professor Muhammad Anwar sir, and my lovely students are there, including Dr. Abdul Aziz, Dr. Asir, and many more students are there. Beyond the people behind this, bringing this webinar, and the delegates who are attending, all of them to my warm greetings and assalamu alaikum to you. As the time has given me to deliberate this content to deliver within 45 minutes, so as I'm taking a privilege to place myself as the significance of the Tadabir Istefraguddam. It encompasses the three very potential regiments of the Unani system of medicine, Hijama first and Irsale Allah, particularly in the management of arthritis. As Professor Anwar sir has initially told about that this is my area of interest, and most of my research work was compiled. I did my most of the research on musculoskeletal condition, along with particularly some of the regimens which make me very passionate to present today's presentation. If you look at the outline of my presentation, let us try to understand the classical concept of the disease and the treatment that makes us to understand the concept and the importance of the genesis of Tadabir Istefraguddam. After that, out of several Tadabir Istefraguddam, the significant importance among the Tadabir Istefraguddam we'll try to understand. Finally, we will speak individually, understanding the Tadabir Istefraguddam with their indications, research outcome, what so far we have carried out, and what is the outcome with reference to the Tadabir Istefraguddam and musculoskeletal conditions, and finally the conclusion. This is the nutshell and what we are going to discuss about this. Yeah, as I told you, the title what we have selected is Tadabir Istefraguddam. It encompasses a complex word of three different meanings here: Tadabir plus Istefrag plus Dam, which literally can be translated as regimens, elimination, and blood. So we are talking about regimens of elimination of blood in toto. These are bloodletting procedures which encompasses three beautifully or most accomplishedly using regimens by the people throughout the history. As in the title itself, it has been brought to the notice of all the august audience and the participants of this program. This Tadabir Istefraguddam, which encompasses Hijama first and Irsale Allah. Let us go to understand before its indications and the mechanism, the concept of disease among the primitive people. If you look at this slide, the first point what I have emphasis here, the primitive man looked on disease as a curse of evil spirits. And they used to treat accordingly. The treatment consists of driving out of the demon which is occupied or possessed by the individual who has suffered. Later, the Neolithic man used flint tools for trepanning the skull to release the demon. Pictorially, we have a photograph here. The people in the late Stone Age, they started trepanning, giving a craniotomy like a structure of the skull, believing that because the demon will occupy the skull, if you remove this, the elements also will come out. This was the practice in the Neolithic age, since primitive man. Now, the Greeks, particularly the tomb, we believe the science of inanimate medicine is laid down upon the principles of the Greek scientists, believe that the humoral balance was the basis of health and illness. Rather, there is no such a concept of evil spirit or the devil forces for the cause of the diseases. As a result of this humoral balance, which is responsible for the health and disease, the concept of evil spirit came into decline, and that has been rejected also. Further, the people who believe about the humoral concept, they started practicing, suggesting certain regimens of elimination, to which we called as Tadabir Istefrag, which encompasses Krai, Ishal, Idrar, through which most of the problem used to be corrected. This is the rationality behind how the concept of disease from the primitive people to the middle people have been changed drastically, and it was supposed to be very scientifically proven also. I'm just trying to bring your emphasis and attention toward a very basic or instinctual thing with all of us. Here are the pictorially, I'm just trying to show you, there is in the center one mosquito. If it bites anybody, particularly the human which like we are, if one another, there is any animal which met with any sort of a noxious substance, if they came in contact, ultimately they'll try to gratify the stimuli which is intended to be a noxious by means of doing scratching over the surface. Like in the left, a girl, she is trying to scratch over the body, and as soon as the They started the scratching. Ultimately, the scratch leads to giving the bleed out. That bleeding will give us a satisfaction, and the satisfaction is just because of the oozing of the. We believe that the substance which is responsible for likely to cause a disease ooze out. We pretended to be an offending substance of poison. This is the thing. Naturally, it is a instinctual in all the human beings, not only the human beings, but also the animals too carry the same kind of instinct that if they can't contact with any sort of a noxious substance, they try to gratify with their own physical movements to eliminate the substances. And luckily, as I told you, as an instinctual as well as we as a human being learn several things from the environment, from the animals and from our elders also. Superadding that, a natural phenomena like a spontaneous nosebleed among the humans and menstrual flows among the humans, and moreover, the similar animal behavior gives us some sort of an insight, which increasingly complex theories as why bloodletting was necessary, how it worked. This was the middle civilization. They forcibly thinking that if we induce bloodletting, it may help the person and free from the diseases. That was the rationality and the genesis of the importance of the bloodletting people in the early civilization. Perhaps the science from the nature led early civilization to put it all together. Bleeding or bloodletting must have some beneficial effect. Let us come to the other part. If you look into the history, the practice of bloodletting or tadabir istifragdam dates back to antiquity. We know since the human being was landed into the earth, one and another way they started getting the benefits of bloodletting procedure. Only hardly we came to know since the documentation was there in the history. According to the historian, somewhere it is begun in the Egypt, in the BC, and the tradition spreads to the other neighboring countries, including the Roman also. From the Unani literature and the medical history, what we learned that the practices were there around the time of Hippocrates, the 4th and the 5th century BC, and the followers are strongly believed in bleeding in certain cases to cure the diseases. Therefore, the Roman physician who reinforced the ideas of the bloodletting procedure, which is discussed by the people of the Hippocrates and their believers. As the topic, as I told you, tadabir istifragdam, this is stand for it's a combination of three words, tadabir istifragdam, literally stand for bloodletting procedure. And here in Unani literature, Unani system of medicine, we have three varied bloodletting procedure, hijama, that literally can be saved with cupping, first venesection and irsal. These are all the three things which is supposed to discuss. But the question is, who is virtuous of this? To whom we can recommend this kind of a procedure, bloodletting procedure. Any one of these are as a complex, one can go for all the three. The question point here is the people who are eligible to be recommended for istifragdam is very fundamental thing is the people whose blood is quantitatively deranged. When there is means the superfluity are people likely to develop have suffering with the diseases of sanguinity. NFL दम के अमराज में मुब्तला हो या अमराज में मुब्तला होने की इस्तेदाद रखते हो, mostly it leads to the predominance of the quantitative derangements of the body fluids. The second kind of the people whose blood is deranged qualitatively, as because उनकी जो तबाही कैफियत बदल जाती है, उसके अंदर रदायत का इजाफा हो जाना, कमियत और रदायत दोनों सूरतों में भी ऐसे लोग मुस्ताहक होते हैं तदाबिर इस्तिफ्रागदम के लिए. So this is the what is called the virtues of the people to whom we can recommend istifragdam. Here, as we have three different regimens, how can we know about that which one is what is called as important, to whom we have to give much importance with reference to the management, because no regimen is inferior to the other regimen here. All the regimens, they are very equally effective, but there is a significant difference of its implication. If you look at this, our Atipa have explained the human body into three different compartments. Like external parts of the body, external and middle parts of the body, and exclusively the internal part of the body. If you look at this pictorially, the right side what you get the brown, blue and black color. The brown color encompasses the external part of the body. If you wanted to get excreta to eliminate the wastes or impure humors from the external surfaces of the body, the best regimen to be recommended is hijama. Similarly, if the substances of the material vitiated matter present in between external and internal part of the body or middle part of the body, the right means or measures of elimination are with the help of leeches or joke that what we have known to do. And finally, if the matter is in the central part of the body, it is in circulation or has been fixed in any particular place of the body, the very courageous point of to be suggestion here is first may prove to be very beautifully help in elimination of such a wastes. So the conclusion here is all the three Tadabir Istifragidam or blood letting procedures have their significance, importance. So one cannot take a lead upon the other. Every regimen has its own importance. That is the reason Atibba, the practitioners recommended individually. We don't find any such a recommendation of suggesting all the three regimens in an individual in any state of abnormal state of the individual. As the very popular regimen of bloodletting procedure from our literature, and it's a globally a very renowned popular technique is the hijama. Literally we can say with the westernized word of cupping, something like a wet cupping also. We have a different synonyms like this: hijama, bilshot, wet cupping, cupping with a scarification, singi lagana, kashne lagana. Many more vernaculars are there for this regimen. Basically, it is what I believe this is a parasurgical procedure that can be induced, carried out with the help of classical that people used to do with the application of the arm, animal arms with that has been substituted with the curbs through which a particular negative pressure or applied over the surface of the skin, the muscular area. I am sure that to the best of my understanding and the work what I have carried, procedure of hijama cannot be undertaken over the irregular surfaces or the articular jaw surfaces. The area should be definitely, it's a muscular and free from any sort of skin related appendages should not be there. So this is a parasurgical procedure that used to be carried out with the help of arms, cups or any other equivalent substance material applied over the skin and muscular area. During the procedure, we will give incision over it so that the blood should come out of the area where intended to be applied. In fact, this is a method of elimination of blood, that's nothing but istifragidam. Particularly, this elimination of blood will be carried out from the peripheral circulation or exterior parts of the body. The objective behind suggesting this cupping among by the Atibba is Himalayan Mawad and Istifragi Mawad. If a matter which is somewhere resided beneath the skin or little bit in between the external, the internal or some other any part of the body, this procedure will help you to divert the material from the deeper portion to the peripheral part of the body. Once if it is diverted, Himala happen, then easily it can be removed from the area. So the basic intention of application of hijama is to elimination of the material, that is the Mawad, with as and then required with the Himalayan Mawad also. In our literature, as a therapeutically, Atibba have mentioned certain specific places are there in the body. Nowadays, as a practitioner, as a person from the academia, I feel very bad to see the practitioners of today's Unani practitioners and the people who are very passionate to use hijama. They are showing so many places in the body where it can be applied and the same kind of a bloodletting procedure can be carried out. For them are the people who are enthusiastic to learn about the importance and the disadvantage of the hijama. I can say in a quoted words, hijama, wherever you apply according to the doctrine of Unani system of medicine, it causes enfeebleness or the loss of endurances of that particular area. And if you apply any area which is exterior or exposed, sometimes it may causes depigmentation also. So there are specific places throughout the literature defined where that one can be undertaken or subjected to the procedure is starting from the head up to the bottom of the body. These are the very few places that you can refer it Yafo over the skull, Nikhra, Kamidwa, Akdan, Sidagan, Tahtul Zikh, Mankab, Kahil, Pistan, Navis, Razir, Khutbik, Birik, Fagdan, Tahtul Rakba, Safen, Pidli, Kaban, Nikat, and Tashri. These are all the specific places where Atibba recommended for therapeutic as well as prophylactic pajama. The other important privileged method of elimination is the first. Here I have a submission. Generally, whenever we come across the term first, we obligatorily use the term vivisection. And here, of course, vivisection, I cannot deny that this is a wrong term. This is also equally acceptable term. First, if you look at the definition of the first, as I believe this is a parasurgical technique or the procedure, which can be carried out on the selected vessels. According to Atibba, they said this procedure can be carried out among the selected vessel. If you try to understand the term selected vessel, it encompasses arteries as well as veins also in the body. If you are carrying this procedure first on vein, then we can say vivisection. If the same procedure will be taken on the arteries, can we use the same term vivisection for the artery? First is a very collective word used by the Atibba in the literature for both the vessels, either a vein or artery. So my submission here it is, probably the first can be literally considered as a phlebotomy. That is a very complex word that can be used for either vivisection or arteriosection or arteriotomy. Otherwise, first may not be a right compensatory word for the vivisection. But here, as we predominantly carry the procedure over the vessels, that is the reason people is using the term vivisection. But my submission is probably whenever you use the word first, the phlebotomy is right to be supposed the right term to be considered. With specifically, if you are carrying the procedure in the veins, it should be a vivisection, or accordingly arteries also, right? As I told you in the literature, as what we believe, this is a method of an absolute elimination. It is called as istifrag kulli. It means it removes an excessiveness of the humors, the abnormal akhlaq in the body in the ratio which presents and which are in circulation without altering its quantity. This is the wonderful concept and observation made by Atibba. That is the reason they said that first is an istifrag kulli बिला तखसीस मादे की कसरत को उन्हीं तनासुब से खारिज करते हैं जिस तनासुब से गैर दरवी तनासुब से जो बदन में मौजूद है. That makes the Atibba's observation to be considered this as a absolute method of elimination. Here in the human body, different physicians have given different numbers of the vessels. There is a big controversy also because nobody can say that that's a certain number only. In the classical literature, we found around 66 vessels are there with individual marking and their indications where that first can be carried out. But out of the different observations in the literature, we hardly learn there are 12 vessels in the head and neck: Yafo, Jabiha, Vidajan, Sidrajan, Arnab, Mafen, Kalpul-Uz, Tahtul-Lisan, Anfiqan, Charrak, Tahtul Kusa, Labba. These are all the 12 specific vessels where for particular indication Atibba used to do the procedure in the head and neck. If you come to the upper limb, both the side, right and left, we have equal number of six vessels are there: Khifal, Basalif, Habluzara, Akhal, Usilam, and Tibbati. Like this 6 multiplied with the 2, 12 again. And if in the lower limb, there are 4 very categorically classified, understood veins are there: Safin, Rukunasa, Mabis Rakba, Kalfal Arhu. These are all the 4 vessels in the lower limb that have been indicated for first. Apart from this, according to Atibba's understanding, there are 2 vessels which is lies between the abdomen and the thorax. One is passing from right side from the liver to the spleen, and another one is which is coming from the spleen to the liver. Of course, this is very difficult to give nomenclature with reference to the Latin version of the names of the classically explained vessels. There is a consistent change in the nomenclature which makes us to follow the original gist of the Atibas names of the vessels here. Beyond this, in our Inan literature, there are certain arteries, around 8 number of arteries also being projected where the first can be carried out. Like Shiryanundar, the radial artery, again it has been divided into two, and apart from that, Shiryanu Khalaful Uz and Shiryanu Sibagan, these are all the arteries where they have suggested for first. But one precaution has given, Atiba suggested that arterial first may not be taken because unless there is a need or there is no alternative mean of controlling the disease. That was the reason usually the first was carried out in the veins only. And the third and the very most important, the very fascinating kind of a is Irsale Alak, and nothing but the leeching. Thus, in our literature, it is mentioned the word alak is a plural form alaka, which stands for the leeching. And this is an annelid, a very popular annelid known for its sucking of the blood. Almost all of you people have come across and have seen and observed this one. Leechings are in fact very beneficial, especially in cases where the process of our elimination regimens are not possible with either first and pajama, and moreover among the very sensitive subjects, either at the extreme ages of the people, like pediatric cases, children, and very sensitive men, and as well as very senior old age people also. Generally, the literature suggested us to recommend leeching because this will may not cause a very painful condition or stimuli this one. In literature and throughout the medical literature, what we found that this Risale Allah leeches were known with the vernaculars. Different vernaculars are declared in Latin. We call it as a Hirdo, Greek, Della, English, Arabicala, Persian, Devacha, Hindi, Jok, Kannada, Kashmiri, Greek, Sanskrit, Jaluka, Urdu, Jok. Like in different languages, it is available. It shows that the importance and the utilization of this particular animal for the purpose of bloodletting in different geographical areas of the world, and its significance importance also. In the modern zoology, they have categorized this animal from the annelids as a Hirdonelia, and the Hirdo is a scientific name for this animal. According to some understanding, there are around 650 species of leeches are available, and most of them are they are either terrestrial or living in the water. Right. In the literature, they have categorically classified leeches of two types. There is a poisonous leeches and non-poisonous one. Certain basic characteristics also been defined. Leeches with large heads and which carry the antimonial color and the black, green colored ones. The leeches which are like a snake, eel fishes, and some of the leeches which contains the very bright color, fine streaks of the bright color. Some leeches which resembles like a kinolon, they are going on changing the color. Leeches which have been cared from the very muddy water are all pretended to be, they are very poisonous. And the Unani Tibba and the people who practices leeches, they are strongly inhibited not to use these kind of leeches because they may prove to be very harm. It may causes the severity of the harm may lead from mild anaphylaxis to syncope and even death also. So one should be taken care while selecting these leeches. In contrast to this, there is another non-poisonous kind of leeches, rather I can say medicinal leeches with the different attributes they have explained. The leeches which are available in the water which contains algae or it contains frogs, the water area where the frogs are there, and the animal which looks like a greenish colored body is covered with the yellow color, yellowish red and brown. Their heads are rounded. All such leeches looks like color like a liver in color, and if it expands and shrinks, it looks like locustus and resembles like the tail of the mouse. Those heads are smaller and thinner. This particular 10 attributes shows that these are all the very beneficial leeches, or rather can say non-poisonous leeches, to whom we can consider as a medicinal leeches that can be used for the purpose of leeching. Out of my interest to bring to the august audience and the program, in the Ayurveda literature, they have given name to the poisonous and non-poisonous leeches. They are very passionate of using the leeches. Rather, I can say the Sharihin al Khanun, the translators, illustrators of al Khanun like Gilani and Amli, they said that practice of using leeches were much more among the Indian physicians rather than the Arab or the Greek physicians. Their experimentation, their observations are based on experimentation. So one can simply relate the observation made by the Indian physician in this regard. So my concern here it is, with the due respect to the Indian practitioners, they are more acquainted with the quality of the leeches and their uses of leech as one of the mean of Rakta Mokshana or the bloodletting procedure or as the Prakritam. Like in the poisons, they have six particular names like Krishna, Karbura, Algarda, Indrayuda, Samudrika, Gokanda. But at the same time, non-poisonous are medicinal leeches like Kapila, Pingala, Sanmukhi, Musika, Pundarika, Savarika. If you look at the characteristics of the features, and all the features of the non-poisonous are equally present in the Unani literature, which says that there is a resemblance and understanding or acceptance of the thought of the literature of the Indian physician by the Arab and the Persian physician of those days who intended to do practice. Yeah. Basically, these leeches, though they are the animals, the modern science says they contains the saliva of the animal contains certain bioactive substances. There is a difference of opinion. Somebody says there's some 100 or 150, nearly some 200 bioactive substances are present in the saliva and the mucus of this leech. Basically, they are going to exert the important function. Out of n number of the claims of these bioactive substances, hardly we can able to find some 2 dozen of such a chemical bioactive substances and their uses. Pyridine, platelet aggregation, kallin, bistabilis, apyrase, cholesterol esterase, triglyceridase, elastase, chloromycetin, tryptase inhibitor, apyrase, collagenase, protease, lipolytic enzyme, complement inhibitors. These are all the bioactive substances with more or less very established efficacy, and based upon their effectiveness only, this particular branch of bloodletting procedure is came into limelight that I'll explain in the later coming subsequent slides. Apart from this, there are particular bioactive substances which are proven to be effective in musculoskeletal related condition, like particularly the arthritis, that I would like to emphasize here. Factor 10A inhibitor, basically this is an anticoagulant substance, but it helps in, it plays a very important role during the process of with clotting, and modern science observed that it has played a very important role in rheumatoid arthritis. Beyond that, carboxypeptidase A inhibitor, this particular bioactive substance help in what is called as the increasing the blood flow at the place of application. Not only that, if the blood flow increases, it provides the elimination of waste products and provide nutrition to that area. The other substances are the histamine-like substances, which is proven to be antispasmodic and vasodilator. Acetylcholine is also another substance which is considered to be as a vasodilator. Bradykinin, in another substance which enhances the fibrocytic activity of the leukocyte and play a very anti-inflammatory function. And the most important thing is, as soon as the leech attaches the surface of the human body, it releases a mucus and a substance which itself works like an anesthetic substance that itself causes producing the pain at the time of the leech bite. Like Herustin, Delin, hyaluronidase, ethylene, kinase, prostaglandins, there are few bioactive substances proven that they are good in painful joints or inflammatory joints because of their different biochemical substances. Some of them are enzymes like trypsin, chymotrypsin, neutrophilic cathepsin G, anti-inflammatory property, plasmin, etc., along with some substances which help in facilitating the action by synergetically or keeping the substances for a long hours to have its effect in the body. In conclusion, I say leeches are proven to be scientifically very nearest the modern chemical substances like carrying bioactive substances, which are very helpful. As the topic of my deliberation is Tadabir Estefrakadam, Hijama, Irsalallah first, and its management in Tadaviristha program, management in arthritis. So let me focus some point about arthritis with reference to Unani medical sciences. The term arthritis is literally stand for inflammatory joint, whereas in our literature, Unani, we have used a very big umbrella term, Vajra facile, which literally stand for painful joint rather than inflammatory joint. Okay. This, as I told, this is an umbrella term. Wherever whatever part of the body is being painful, we use generally Vajra facile as a term. Like in here, see this, if different organs have been nomenclated with a different Vajra. Like if a person complain of neck pain in a literature and we say this is a Vajra rakbar, shoulder pain is Vajra katif, elbow joint pain is Vajra marfiq, wrist pain is Vajra razid, Vajra khutr, that they pushed again in the back. We have two upper part, upper back is zohar and lower back is a fasira. Vajra burik, hip joint pain or kologadar, Vajra rakba, knee joint pain, Vajra calf, ankle pain, Vajra akab, heel pain. These are all the different the articular surface related pain, though they have been not directly defined with this individual name, but as a whole, all these articular joint pains were described and managed with a very umbrella term Vajra facile literature. Beyond these articular surfaces, there are two metabolic conditions which are also responsible considered by Unani Atibba as part of the Vajra facile is Nicholas, gouty arthritis, and Iroquois, the sciatica. Here in Unani, we have the etiological classification of some arthritis is there, the Vajra facile. This etiology, again, if you look into this, based upon the involvement of the matter, or something like a fluid, or some other materials. So we have the six kind of involvement of the matter. If it is a Damavi, Balgami, Safravi, Saudavi, or Rivi or Mai. Accordingly, based on the predominance of this madda and the symptom, they were contemplated or categorized as a Vajra facile with respect to the predominance of particular field. And there is another compound kind of Vajra facile is also described with two different variants, Balgam plus combination of a Safra or Sauda plus Safra. The purpose of bringing this information is to explain the importance of Tadabir Istifraquddam in elimination of the matter. What the Unani science believes that the cause of a sub-disease is the involvement of the matter. So the very important point is the management of arthritis with Tadabir Istifraquddam. How this Tadabir Istifraquddam, either hijama, burst or irsal is helping in management of arthritis. If you look at this hijama, as in the previous slide, I tried to convince you to show you different places. Are there around 20 places has been defined where wet cupping or literally blood lifting procedure of hijama can be taken. But throughout the 20 places, hardly we can find two places. One is the Tahatur Rakba, that is Tafne ke niche, the Gutne ke niche wala hissa, where the people suffering with a Vajra facile Damavi, and a very typical characteristic of the pain when the patient complains of tikor wala darj hota hai, there's something like a pricking or something, itching kind of a pain. In such a case, Gilani told such a people should be asked to stand over the foot, and so that the specific procedure is being recommended and suggested that the procedure of hijama can be carried out at the base of the thigh bone mediolaterally by giving multiple incisions based upon the endurance of the material or the suprafluidic condition. This is the one condition where Atibba have explained about arthritis, the two predominance of balgam, predominance of dam, or whether the balgam with safra. These are the two conditions of knee-related pain. Only they have specified Tahatur Rakba is the place of hijama. Apart from that, for sciatica, Kabine is a place which is indicated. Nichras for Nichras gouty arthritis, hijama can be indicated. If people can ask them to go for hijama procedure or the Kabine. These are the two specific indications of musculoskeletal conditions where hijama, wet cupping can be carried out. Beyond that, the other forms of arthritis are little bit need to be revived. The second procedure, first the venous section, Totally it is indicated like it is istafrag kulli. That's the reason whenever there is an involvement of the Damavi Madda, Atipa says that either you have to go with the basalif, the first of the basalif or the safin. If a person suffering with Irkunasa sciatica, recommended to go for the sciatic vessel or Irkunasa hip pain first kiya jaye. And if the person who is suffering with the hip joint pain also, it is suggested to go over the venous section of the Irkunasa, the sciatic vessel. The second place is Mabis Rakba, that is Tatur Akbar. Mabis Rakba is also been indicated for sciatica pain if the patient is unable to come there. Khalaqul Arqub is the area of the heel where the person is complaining of heel pain, one can be taken care of this procedure. And the most important point, Usilam basically is a vessel of the upper arm, a very small, very delicate, fragile vessel. Though because of its capacity to absorb the material from the lower part of the body, Atipa recommended for chronic low back pain, you can take the help of Usilam venesection that will be very helpful. Irsale Alaf, this is what I have observed is, there are so many biochemical substances. With the help of the biochemical substances, today the modern research and most of the clinical trials are also being proven that it is effective in osteoarthritis, rheumatoid arthritis, psoriatic arthritis, gouty arthritis. These are all the places where this management of arthritis can be carried out with Tadavirus tetrahydrocannabinol. I would like to come to the very conclusion, Mr. Abdulaziz, and I can able to understand the probable mechanism of action, how this Tadavirus tetrahydrocannabinol is going to help, how they are going to facilitate the mechanism of action. If you look at this, hijama basically, it is a procedure, either it is causing the diversion of the material which is responsible for the tamaddud and the pain. That is the reason it helps in diversion. And second thing is the elimination. These are the two phenomena through which it helps in relieving the pain with the help of hijama. If you come to the first is also causing diversion, and any superfluid fluidity will be removed in a particular specific vessel. The very passionate point, which again from re-emphasizing here, it is Irsal leaching. There are a number of bioactive substances, anesthetic there, acetylcholine, which helps to vasodilate, pyridine, delin, ethylene. All these bioactive substances work like an anti-inflammatory, collagenase stress, platelet agglutination, it prevents platelet agglutination. They contain a number of anti-inflammatory trypsin, chemotrypsin-like enzymes, and histamine-like substances, hyaluronidase. All these things will help in the perfusion of some of the chemicals which can act like an anti-inflammatory analgesics and anesthetics in the pain management. Coming to the conclusion, research outcome with reference to the Tadavirus tetrahydrocannabinol. I am very much thankful to the organizer, particularly Anil sir. He has given me the opportunity, and during his inaugural address, he emphasized about, because for the last 16 years of my career, most of my research work was completed on Tadabir only. But Tadabir tetrahydrocannabinol, except leaching, I have found a little effectiveness with either hijama or first the musculoskeletal problem. So I'm coming to that point. My observation is satisfactory work has not been done with the Tadavirus tetrahydrocannabinol musculoskeletal disease. I mean, this is the area where one can be focused on. Whatever the work is carried out, usually the research which is lacking methodological errors we have observed. Not only mine, in the most of the work carried out by the other Unani practitioners, surgeons, researchers, what we have observed, their protocols are lacking, some methodological errors are there, and most of the studies deficient in control of confounders. So it cannot be concluded that exclusively effect of the regimen, either Irsalala or hijama or first, are just exhibited because of this particular regimen. Because there are so many confounders out there that equally interfering into the effect of the regimens. I can say, so based upon this observation, we can say claims cannot be made about their effectiveness because it needs to be revived. However, Irsalala is found to be very boon with the hidden effects, as a number of bioactive substances are proving their effectiveness one and another way. Now they are also getting benefit to the people also. Conclusion, though Tadavirus tetrahydrocannabinol were ruled throughout the dark ages as a means for management of different diseases, including fever, headache, chest pain, even dyspepsia also been treated with the Tadavirus tetrahydrocannabinol one another way. But the period of Renaissance and the concept of the germ theory, the emergence, leads to the downfall of the Tadavaristha. Mean there was a time where it was ruled like anything, but the germ theory and the period of the Renaissance makes the downfall of these classical regimens. Right now, recent revival of Tadavaristha with their significance are in limelight for their beneficial effect. That is the reason. There is a scope. Now people are also getting benefit with this. My observation is this: out of these three, first the hijama, inshallah is found to be a revival in the field of plastic and reconstruction surgery and cosmetics also. So there is a good future of inshallah along with the other two equally applicable. Finally, thank you for listening to me. And thanks to the organizer for giving opportunity to me. And probably my time, allocated time, 45 minutes is over. It's over to the organizer and the moderator.
Thank you very much, sir. Definitely, you are on time. You started on time and finished on time. And you make us, just listening very to your presentation. The beauty of your presentation that you highlighted the very good benefits of your Tadabire Istifaragedam. And definitely the demerits and what are the drawbacks, what are the limitations that all has been countered, and what are the prospects in future that what we can be done, what are the methodologies that can be adopted, what are the methodologies using VR that has some certain corrections needed to be. So definitely it is going to be a mind-blowing lecture from your side to the audiences. Thank you from my side and from the organizing committee that you have delivered a very nice lecture. Definitely these two lectures come to an end, and we are heading towards the programs in the forward. Thank you very much, sir. Thank you for this, sir. Ladies and gentlemen, it was the time to listen our principal Ajmal Khan Tibia College, Professor Saud Ali Khan Sahab, but he is busy in some very important meeting in the university. At the university, NAC team is going to visit and we are going to submit our NAC performa SSR. So he's very busy there. So I very thankful to Principal Ajmal Khan Tibia College. Now I'm going to invite our visionary and learned dean, who despite his exceptional qualities as a teacher, is known down to earth to his colleagues and students. A master in Kulliyat, Temur Tabiya. Our beloved dean, Professor F.S. Shirani sir, is known for his soft skill and is a good God-gifted healer. He is an icebreaker in the field of researches in Kulliyat. He has successfully completed a project on nerves. He has developed many instrumentation for empirical assessment of human temperament and Unani classical guidelines, that is Ajnat Ashra. He believes in goal-oriented strategies dedicated to strengthening administrative operations to streamline cost and enhance procedures, cultivate long-lasting relationships with the students and staff to strengthen program success. Motivational leader with top-notch communication, organizational and strategic planning abilities. He has probed, encouraged and facilitated class discussion by building discussion into lessons, asking open-minded questions and using techniques to track student participation and actively solicit input. He shifted between informal and formal methods of teaching to create multi-layered web of learning, incorporating experiments, practical activities, discussion and project installation. With due regard, I modestly request you, sir, to please come over the dais and address the gathering. Professor F.S. Shirani, sir, Dean Faculty of Unani Medicine.
Thank you, Dr. Aziz, for the introduction. Professor Saud Ali Khan Sahab, Principal Ajmal Khan Tibia College. Professor Muhammad Anwar, convener of Hakeem Ajmal Khan Memorial Extramural Lecture. Guest speaker, Professor Alimuddin Qumri, Head of the Department of Muolajat and IUM Bangalore. Learned speaker, Dr. Ghazala Javed, Research Officer, CCRUN. Members of the organizing committee and moderator of this EML, Dr. Abdul Aziz Khan, dear colleagues, participants across the country. We have been listening brilliant talks on some very relevant issues Learned speaker Dr. Ghazala Javed has vividly delivered her talk on bioethics in clinical research and practices. She has very elaborately pointed out the lack of wills of clinician for informing subject about inherited risk of disease and side effects of drugs and other expected complication, which is of course now more important and more relevant ethical and legal implication in clinical practices. Her concern about impending layback bioethical attitude of clinicians in the post-COVID is definitely alarming and inevitable also. Because due to the urgency and cutthroat competition and commercialization of health sector, the clinician as well as researchers have been expected to give little heeds to bioethical issues. Dr. Ghazala, we are very much impressed about your concern and knowledge about the bioethical issues in the treatment of disease and also in the clinical research. Dear friends, we are always delighted to hear scholarly deliberation of Professor Alimuddin Kumri. But a talk on istafrag or evacuation of morbid humor is definitely become more relevant if erudite and experienced speaker and clinician is talking on it like Professor Kumri. He has created a niche and great deal of experience and expertise in this particular field. That is why we have maximum number of participants in this extramural lecture. All claims to complete treatment and relief from constant pain and distress of arthritis by many pathies are actually based on false propaganda, because most of them especially managing the disease instead of treating them. But the concept of akhlaq, tabiyat and usul ilaj are quite different from others. To prove the scientific validation of first, we have done some research and practical in our lab or laboratory where I am presently sitting. We have applied Poiseuille's equation and Newton's law, which says viscosity is property of fluid related to the internal friction of adjacent fluid layers sliding past one another, as well as the friction generated between the fluids and the wall of the vessels. This internal friction contributes to the resistance to flow, whereas the Poiseuille says, as per the volume flow per time was proportional to the pressure, and inversely proportional to the tube length. We took 3 industrial capillary tubes of the same length and diameter and equipped them with color sensors. We have pumped 3 fluids of different viscosity through nitrogen pump, found that more viscous thick fluid takes to reach the sensor's marking. Let me show you the video of that experiment. This convincingly proved that the mixture of fluids differently are traveling different speed and reach to their peak on different sites in the human body. Please share my screen. Hello.
Sir, you have option for sharing your screen.
Yeah. Can I play the video?
Yes, sir, you can play the video. The screen sharing option is open for you, sir.
All right, yes. My screen is showing on the screen?
No, sir, it's not.
Okay. So when we get incision on the side, the peak morbid humor get out of the body. Bleaching and cupping is nevertheless more significant and effective method of treating arthritis. I must congratulate Professor Mohammad Anwar, convener of this extramural lecture, and his team, Dr. Ammar Ibn Anwar, Dr. Mursaleen Nasir, and Dr. Muhammad Shoaib for selecting very relevant topic for the lecture, as well as inviting experienced speakers of such a class. Thank you very much.
Thank you very much, sir, for your concluding remarks. Your words of wisdom will definitely give us a niche and a guidelines and a very informative for all of us. Thank you once again, sir. Allah subhanahu wa ta'ala says, La in shakartum la azidannakum. The success of any program necessitates cooperation from all well-wishers, whether it be the patron, guests, speakers, delegates, the technical support team, and the member of the organizing committee. So I invite Dr. Ammar Ibn Anwar, Assistant Professor, Department of Tahaffuzi wa Samajdi, Faculty of Unani Medicine, a devoted, dedicated teacher, to accord vote of thanks with this hadith, Man lam yashkurun nas lam yashkurullah. Dr. Ammar Ibn Anwar, for vote of thanks.
डॉक्टर अम्मार आप अपना माइक अनम्यूट कीजिए।
Assalamualaikum. Am I audible to you?
Yes, you're audible, sir, please.
Bismillah ar-Rahman Rahim. Respected teachers, eminent speakers, valuable participants, my dear colleagues, and beloved students. Assalamu alaikum. Now we come to the end of this lively gathering of the extramural lecture. Prior to winding it up, a few words of thanks and gratitude to all of you. First of all, I would like to thank the Almighty Allah who have bestowed upon me the opportunity to have this pleasant task to propose a vote of thanks. Allah subhanahu wa ta'ala says, if you are grateful, I will surely increase you in favor and mercy. Holy Quran, Surah Ibrahim, ayat number 7. I owe my gratitude to say a sincere thanks to our Honorable Vice Chancellor, Professor Tariq Mansoor Sahab, for providing the permission to the extramural lecture series. And this is the second celebration of this series. We all are really blessed to have a Vice Chancellor like you, sir, as under your dynamic administratorship, MD seats of our faculty got doubled within a short span of time. Now at present, we are having a 36 number of seats, and within a short time, with the enhancement of the seat, it will become, inshallah, 42. Thank you very much, sir, for this outpouring support and kind consideration of our request each and every time. My next very sincere and heartfelt thanks goes to the most vibrant and versatile personality, a jubilant orator, a Professor F.S. Shirani Sahab, Dean, Faculty of Unani Medicine. At this juncture, I am very confident enough to say that Faculty of Unani Medicine will truly be benefited by the vast experiences of Professor Shirani Sahab, and we will achieve many more milestones in our journey to the success. I, on behalf of Aligarh Muslim University and the entire faculty of the college, extend my most sincere thanks to the renowned physician, a learned speaker of today's extramural lecture, Professor Alimuddin Famri, Head of the Department of Collegiate, National Institute of Unani Medicine, Bengaluru. I am highly thankful to you, sir, for accepting our invitation, for delivering the wonderful lecture and sharing your valuable time with us, sir. I am immensely thankful to our another learned speaker having a remarkable expertise in the discipline, Dr. Ghazala Javed, Research Officer, Scientist in the headquarters of the Central Council of Research in Unani Medicine, for the thought-provoking lecture and sharing of the experiences from his vast knowledge. I am in depth highly thankful to the zestful administrator, the dynamic personality, a keen observer, and the person of the strong character, Principal Ajmal Khan Tippia College, Professor Saud Ali Khan. Thank you very much, sir, for your kind cooperation and overwhelming support, though he is not present here at the moment. An event of this dimension can't happen overnight. It needs meticulous planning and execution and an experienced eye for details. So this regards I am indeed grateful to the convener of this extramural lecture, a person of the strong morale and determination, Professor Mohammad Anwar Sahab. Thank you very much, sir, for the valuable insight and teamwork for organizing this event. Thank you very much, sir. The talent win games, but the intelligence and the teamwork win championship. I am immensely thankful to sincere team support by Dr. Musaleen Nasir, Dr. Muhammad Shuaib, Mr. Tanveer Firdausi, who dipped their oar in the turbulent water and have sailed it to the shore of success. I am privileged and honored to express my hearty vote of thanks to the director and the staff members of the Professor M.N. Farooqui Computer Center, Aligarh Muslim University, Aligarh, for the logistic online support. This is a very vital part of the web event. It is a truth that speaks in itself and need no evidences. So I am extremely thankful to all the staff for the rectification and the technical issues and the sincere cooperation in organizing this extramural lecture. I feel pleasure to thank a person with wonderful style and art of managing the live event, a moderator of this event, Dr. Abdulaziz Khan, for their sincere and splendid effort toward anchoring of today's deliberation. I mention my deepest sense of appreciation and will place on record my hearty thanks to my dear colleagues, Abdulaziz, Dr. Abdulaziz. My special thanks goes to all those who have provided the technical support, even a moral support, materialistic support, and everyone who have contributed to the success of this extramural lecture. Last but not the least, I am really and extremely thankful to all the learned participants, without whom this deliberation is never be a success. My deep regards and thanks to all of you. Once again, thank you very much and thank you everyone. Shukriya.
Thank you, Dr. Thank you very much. Thank you everyone for your patient hearing and learning. So this program comes to an end. Inshallah, definitely we'll meet again. We are parting here to meet again for some,
Thanks a lot.
and good work for the researchers and the academics for the betterment of the university. Thank you very much. Stay home, stay safe, keep physical and social distancing, use face mask. Thank you very much. Thank you once again.
Thanks.
Thank you, sir.